Good morning and welcome to Ask Dr. Murphy This Week in Public Health. Bonus episode this week is Dr. Murphy is joining us from Africa. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion, where I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, thank you for joining us.
Yeah, hi, Katie. Thank you so much.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines submitted through today, May 15th. We welcome and would like to have any questions or comments down below or at any of our social media linked in the description. Starting today with an update on the Hantavirus. Dr. Murphy, can you bring us the latest news?
Yeah, it's still an evolving story, as everyone probably knows. As of now, on the passengers on the boat that were from, there are 9 confirmed and 2 suspected cases that we've talked about a lot. So that's still happening. And then of the US cases, there are 41 people in isolation right now. Emory has 2 that are sick, and they're in like a medical unit. They don't necessarily have hantavirus, but they're sick with who knows what they're sick with. The another 16 are in Nebraska, the unit in Nebraska, which is a quarantine unit. One of them, actually a doctor, has tested positive and negative back and forth. They're waiting to try to confirm one way or another, but he doesn't have any symptoms. He had a day or 2 of some very mild symptoms a while back, and that might have been it. But he's a little bit of a puzzle. Then the rest of the 41 are scattered throughout the United States, and I think most of them are being quarantined at home. These are people who had contact with people that were on that boat. So people that were on the airline where the lady died, she actually ended up not, she was only on the plane for about an hour where they actually took her off the plane. The plane never took off. But some of those people, did have some kind of exposure to her, which just brings up the whole um, idea of like how much exposure is bad. They keep saying, oh, it's never going to be a pandemic or whatever. But remember, this Andes virus does transmit person to person. And some of the people that have documented infection had very little exposure to the couple, the Dutch couple, who both the couple died. Was the first person who died on the boat was this man, and then his wife is the one that died in the airport or had just gotten off the airplane. She died in a hospital, actually. So some of the other people that are documented to have the infection had minimal contact with them. So we don't know exactly, what the contact situation is, how much contact is really too much. But it's just that strain. The strain that we have here in the United States is called Sonombre. It's very different, and all the cases we have here, including the case that was recently reported from Illinois, was definitely from these a type of mouse that in the wild that is suspected to be giving it to the person. It's not human to human transmission. So all the cases in North America, and we had 8 in Illinois since 1993. There's about 30 cases per year. They're from animals. They're from the animals. This still has a high mortality rate. So the person that's recently infected looks like they're doing okay. But that's kind of the story. It hasn't really changed, but they've dug up some better statistics, like the 8 patients in Illinois. Last week, we thought there were only 3, but actually it turns out there were 7. And then this is the new one, which is in the Rockford area, is number 8. So it can be kind of anywhere. About half the states have reported at least one case. And it looks like the epidemiology is changing a little bit in that, it used to be a very rural disease and poor environments, where there were a lot of mice running around and stuff. And, the last couple of cases, of course, Our Gene Hackman's wife lived in a very, very well-to-do posh house, and this is certainly not, you know, a poor area or anything where they lived in New Mexico, and this whole boat full of, wealthy travelers on a luxury cruise. I mean, it just something's changing with this. Argentina, by the way, has a lot more hantavirus than we do. This is the Andes virus, one that goes human to human. They've got probably somewhere between 15 and 20 times more cases than the United States does. And no one knows why. It's either the animals are more widespread there, or there's more, the human-human transmission is one of the drivers. Nobody knows. We're just thinking. So that's where we are with hantavirus.
Mhm. And as we do, or we may see more cases pop up, I understand there is at least one patient from the initial outbreak who is in critical condition, while there has been only 3 deaths thus far. Is that true?
That's true. This is the woman in France who's on life support machines, actually, to keep her alive.
Very unfortunate. We will keep our eyes and ears open on this story, of course. But if
Mhm.
we get into our COVID news for the day, we have actually two large trials that were published in the New England Journal of Medicine looking at Paxlovid and how it has evolved in its role against COVID. Can you break it down for us?
Yes, well, Paxlovid was it's a combination drug. It was the approved it was the first oral drug approved. Remdesivir was the first one, the intravenous one, and it originally had a very dramatic effect with a survival benefit and decreased hospitalizations. I mean, it was overwhelmingly uh, remarkable. However, now as the immunity has increased in the entire population, that hospitalization rate benefit and the death rate benefit have disappeared. Now, it's an antiviral drug, so the amount of virus in your body goes down, but the body is everyone is able to handle it much better. They did note in this study that the patients were sick for fewer days, and there were fewer interactions in the emergency departments with those people. That's a pretty modest benefit. However, we know that Paxlovid, I mean, we know that COVID can cause long COVID. It can cause all these other things. It can cause cardiac problems, increased incidence of heart disease and heart attacks. So we don't know the impact of that. And we may never know because that would require, really a massive study. So, that's just a theory that, you know, taking Paxlovid might help there. But this is just a big question mark.
Now, our next story is much less of a question mark, but it's the phase 3 trial from Moderna regarding their mRNA flu vaccine. Over 40,000 patients, and also published in the New England Journal of Medicine. Can you bring us those results?
Yeah, this is the Moderna big flu study. And they showed, and this is what, after they got it approved by the FDA to do this study with this particular design, remember the FDA didn't want to review it. They didn't even want to review it. Um, Ultimately, they allowed it to be reviewed. And so the results are that the now it's the same thing. It's a flu vaccine, but it's whether made from mRNA or the egg-based ones that have been around for decades. Um, we know from other studies and from this one also that the overall immunologic response to the mRNA vaccine is better than the older vaccines. And so they did find a decrease in the number of flu cases. It was 2% versus 2.8%. And it doesn't look like a lot, but when you have 40,000 patients, that ends up being quite big. The mRNA vaccine group also had more side effects, but they were minor and they resolved. There was no new side effects. It was just the same old stuff. When a lot of people take the flu vaccine, they feel like they have the flu. They feel achy for a day or two and a little soreness where the injection is. So there were more of those, but it was the same old, same old. But this is it is an improvement. And because
It's
there's
an
lots
improvement.
of immunity to flu out there because so many people have had the flu. It's the same situation like with COVID.
Absolutely. And that mRNA platform is so important because it can be so easily adjusted. Those vaccines can
Yeah.
be made so much quicker than the cell-based ones.
Yeah, no, it'll help egg prices too because we'll have to use so many eggs.
And our next study today is actually a systematic review of a bunch of other studies, but once again, more evidence that aluminum in vaccines is not linked to autism or other health problems. Can you break it down for us?
This association has been debunked so many times, and this is just another analysis of 59 different studies around the world, including a study in Denmark that was carried on for 24 years. And that involved 1.2 million children in that study. And they don't find any association at all with aluminum and autism. So it's just more data. They do note that aluminum containing vaccines have slightly more nodular um, reaction where the injection is given. Like it feels a little lump there, but that also resolves. But that was the only thing that they found. And they looked at 59 different studies from around the world. And really quite amazing. You can't get away from aluminum. It's the most common substance on Earth. It's 9% of the Earth's crust is made of aluminum. Aluminum is in water, it's in the air, it's in any aluminum can, anything you drink, it's in baby formula. It's kind of in everything. So you cannot have an aluminum-free environment in a place like the Earth because there's so much aluminum. So it's not associated with autism. And the amount of aluminum in a vaccine is if you take, I think the analysis was, if you take a little raisin and you chop it into 1,000 parts. Now imagine that. Those would be very little parts. It would be like one of those parts. Okay. So it's really a minuscule amount, and it's aluminum's everywhere anyway.
Mhm. And our final story for today is actually a modeling study from the Yale School of Public Health. And we've talked about rotavirus as the vaccine trouble has come up. But can you tell us this modeling study, how many cases of rotavirus are there and how many could there be?
Well, the thing with rotavirus is, I mean, it's out there. Adults can get it, but an adult can handle a little diarrhea. Now, if you're a little kid, a little, very small child in particular, that amount of diarrhea actually can be life-threatening in terms of the volume of fluid in your body. So kids can die from rotavirus. And many of them get hospitalized. So currently, well, in the last couple of years, before this whole anti-vaccine thing came up, 75% of kids were getting the rotavirus vaccine. And still, we were having 36,000 kids hospitalized per year. And this is vaccinated and unvaccinated. So if these authors here have done the study, calculated that if it drops down to 60%, which is the direction that it's going, that number of hospitalizations will go from 36,000 to 85,000. All right. That's a very big increase and thousands of babies hospitalized. Children don't get hospitalized too much anymore, because all these diseases are prevented. But now the diseases are going to come back. And if it really goes down hill with the vaccine uptake, say if it goes down to 20%, that 36,000 hospitalizations turns into 204,000 hospitalizations. I mean, that's a lot of hospitalizations for kids. So it's just, I mean, if you take this path of, not taking these vaccines for preventable diseases, you're going to pay for it in the hospital. You're going to have a lot more sick people. And in this case, it's children.
Yeah, it's a very scary outlook there, but thank you so much, Dr. Murphy, for your time and your expertise joining us from halfway across the world this episode. It's much appreciated.
Well, thank you, Katie.
And thank you all for joining us for Ask Dr. Murphy this week in public health. We hope to see you back next week. And as always, any questions or comments are welcome down below or at any of our social media linked in the description. Have a nice weekend.
You too.